Okay, in this video, we're going to talk a little bit about acute foot and ankle pain, or more specifically, how do we target acute injury in the foot or ankle, or a foot and ankle that has become what we would classify as movement sensitive. And we're specifically going to talk about this with respect to our exercise prescription. Now, as always, let's start with a little bit of context. And as I've talked about many times in the past, when treating pain and dysfunction, the first thing we really need to do is to develop tolerance to basic movement. Now, I think of it this way. In this case, if we're talking about the foot and the ankle, if this area can't perform basic motion like dorsiflexion and plantar flexion or pronation and supination, the foot is either going to hurt all day, or gait or other weight-bearing activities are going to be significantly altered, as the body has to find alternate movement strategies to avoid the painful movements and painful positions. So in dealing with a painful and sensitive foot or ankle, we need to focus our exercise prescription towards building tolerance to these basic fundamental joint motions. And what I'm going to do here is I'm going to review my basic movement sequence that I would use for a painful and movement sensitive foot or ankle. Now with that said, let's go over the movement routine itself and look at the 4 specific exercises that make up the routine. Then once we've covered the specific exercises, I'll wrap up the video by discussing key programming and progression criteria. That's where we're going to talk about things like how many sets and reps the patient needs to perform, how often they need to perform the routine, what's okay and what's not okay as far as symptoms that they may feel during the exercises, and when we know it's time to progress the patient into the next phase of care. And just as one last FYI, remember, if you are a My Rehab Connection subscriber and you use our exercise prescription software, you can find all of these exercises in our exercise library. You can either search for them by name in the library itself, or you can find the movement sequence in the exercise group section under the title Basic Foot Ankle Movement Sequence, Pain Mobility Focus. Now with that said, let's look at the exercises themselves. The 4 exercises that make up the sequence are going to be the ankle dorsiflexion plantar flexion mobilization, the ankle inversion eversion mobilization, ankle squares, and toe flexion extension mobilization. Okay, so the first exercise that's going to make up the sequence is our ankle dorsiflexion plantar flexion mobilization. So what we want to do here is we just want to kind of get the lower leg supported, and we want the foot just to kind of be suspended in air so it's free to move. Now from here, I'm simply going to have the patient pull their foot up as far as they can, pulling their foot up towards their lower leg. Hold for just a 1 to 2 second pause, and then they're going to push their foot down as far away as they can. And they're simply going to perform 10 slow, deliberate repetitions back and forth. Now again, as I'll talk about in more detail when we get into the programming progression criteria, the idea here is we're going to go move slow. We're trying to create almost like a pumping or a milking action through the foot and the ankle and the muscles that live in these regions. And we're going to move as far as we can. So mild symptoms are going to be okay and acceptable. But if it's painful, we can limit the range to make sure we keep it at a tolerated level. Okay, the next exercise we're going to look at is our ankle inversion eversion mobilization. So again, we're going to use a similar position that we used for our previous exercise. We want our lower leg supported, foot is free to move in space. From this position, I'm going to rotate or pull my foot outwards, hold 1 to 2 seconds, and then I'm going to bring my foot inwards. And I'm going to slowly perform these back and forth motions, moving into eversion, hold for 1 to 2 seconds, moving into inversion, holding 1 to 2 seconds. Now, as I'm doing this, I'm trying to focus the motion at my foot and ankle as much as possible. I really want to try to minimize the motion of my leg back and forth. We don't want the leg or the hip contributing to the motion. We want the stimulus and the movement effect to be at the foot and ankle itself. Lastly, with these exercises, we are going to go slow, deliberate, and we're going to move as far as we can into each position. Remember, some mild symptoms are going to be okay and acceptable, but we're not trying to force into pain. So if you do get symptoms moving in either of these directions, we're still going to perform the movement, but we're going to limit the range or how much motion we're using to make sure we keep the symptoms at a mild or tolerated level. Okay, this next exercise is really a variation or a progression of our basic inversion-eversion mobilization and our dorsiflexion-plantar flexion mobilization. So here what we're doing is essentially combining those motions to try to target all of the various positions that the foot and ankle can use or might have to be in. So again, we're going to use our same position. We want our lower leg supported, foot is free to move. Now here we're going to imagine that there's a imaginary square down at our foot or ankle, and we're going to try to trace the square. Now the order in which we do this or where we start is really quite arbitrary. We're just going to try to kind of touch all four corners and trace all four sides. So in my example here, I'm going to start by pulling my foot up towards me into dorsiflexion. Now the idea here is that we're trying to pull our foot back into the top of the square. Now I'm going to try to hold into the top of the square. I'm trying to hold that tension with my foot being pulled upwards. And here I'm going to try to slide to the outside as if I'm trying to touch the upper corner of the square. Hold for a second, and then I'm going to go to the inside as if I'm trying to kind of touch or move into the top corner of the inner square. As I'm holding my foot up, I'm moving back and forth into inversion-eversion. It's as if I've got my square and I'm trying to slide back and forth along that top line or the top edge of the square into the top two corners. Now I'm going to perform 5 repetitions back and forth, and then I'm going to go to the next side and try to touch the next group of corners. So in my example here, I'm going to pull my foot to the outside and holding to the outside as if I'm holding along that outer surface of the square. I'm going to try to pull my foot up into the upper outer corner, hold for a second, and then I'm going to try to pull my foot down into the lower corner. I'm going to try to pull my foot up and down, trying to kind of slide along the outside of the square, and I'm trying to kind of touch those outer corners, upper and lower corners of the square. Again, 5 repetitions, and I'm going to move on to the next part of the square. Now I'm going to pull my foot down as if I'm trying to push into this bottom edge of the square, holding my foot against that bottom edge of the square, or excuse me, bottom side of the square, trying to keep the tension, pushing my foot down. I'm going to rotate my foot. I'm going to go into the lower corner of the square, holding for a second, then into the outer corner of the square. I'm going back and forth as if I'm, again, sliding back and forth along the square, trying to get those 2 lower corners. And then finally, we'll complete our square. I'm going to pull my foot to the inside, and I'm going to try to go into the inner upper corner, inner lower corner, inner upper corner, inner lower corner. Again, I'm going to go slow and controlled, very deliberate. I'm going to try to minimize movement of my leg. I want the motion stimulus happening down at my foot or ankle. Now finally, remember, in terms of how much range that we're using, we want to move as far as we can into each of these positions and each of these quadrants, but we want to make sure the motion stays tolerated. In other words, if we get some symptoms, but they're mild achy symptoms, again, we're perfectly fine and okay with this. If there's pain with any of these motions or positions, we're still going to move towards those positions, but we can limit the intensity of the motion to make sure we keep it within a tolerated level. All right, this is going to be our toe flexion extension exercise. Now, the key here is we're trying to work on or look at exercises to help influence acute or movement sensitive foot and ankle conditions. But we need to keep in mind that the toes are a pretty significant and important part of the foot. Also keep in mind that a lot of the muscles that would flex and extend the toes are, of course, foot muscles. They live on the top or bottom of the foot. So we do want to make sure we include some toe exercise in our basic foot ankle exercise routine. So in this case, I'm simply going to do this from a kneeling position just for the sake of ease, but keep in mind you could do this from a seated or a standing position as well. The key here is we do need to get our foot up on the edge of a step or a stair or a book, or in this case, I'll use a yoga block here. The key here is we need to create some space in order for the toes to move, particularly into flexion. So here I'm just going to simply get my foot up on a block. I want my metatarsals, or the edge of the foot where my toes meet the rest of the foot, just to be supported so my toes are free to move over the edge of the block. Now from this position, I'm going to simply curl my toes down as far as I can. I'm going to hold for 1 to 2 seconds, and then I'm going to try to lift my toes back up into extension. And I'm simply going to perform 8 to 10 slow repetitions back and forth. Remember, we want to move as far as we possibly can, but we can limit the intensity or the range that we are using if needed, if there are any significant symptoms when performing the movements. Remember, we also want to be deliberate when I'm curling up and I'm curling down. I want to be conscious to keep the motion in the foot and in the toes themselves. I want to focus on trying to feel those muscles stretch and contract in the foot and around the toes to get the best stimulus possible. All right, now that we've gone over the program itself, let's review our programming and our progression criteria. Now, first off, remember the key with these basic motions is to move to symptom tolerance. In other words, we want to move as far as possible into each direction, but we do not want to force the foot or ankle into painful positions that it might not be ready for or it doesn't feel safe moving into. The balance we're really trying to strike here is that we don't want to avoid movements altogether, as we know these movements can be such a powerful way to influence tissue and guide healing, but we also don't want to force the motions and flare up the condition. So the basic rule of thumb here is that some mild and achy symptoms are not only okay, but they can often even be beneficial to help dial down the pain response, but we want to limit the range to keep it within tolerance. Now also remember that we need to often explain this to patients, especially with a really acute ankle sprain or a significant foot pain that may make the patient a little hesitant or even fearful of moving, especially if these specific movements reproduce some of their symptoms. Now keep in mind here that it can be very helpful to point out to patients that these are all gentle, non-weight bearing exercises. And what this means is that symptoms that they may experience with the movements, at least if we are keeping the movements to symptom tolerance, as we just discussed, are going to be more a result of tissue inflammation or sensitivity as opposed to further damage or injury to the area. Now, as far as programming, the typical prescription is going to be to perform each of these movements for 10 slow, deliberate repetitions. And then they're going to repeat this sequence every few hours. The idea here is that we're trying to create a light, easy, controllable stimulus, but we want to provide this stimulus on a regular basis throughout the day. Now, the other thing to point out here is that we don't have to prescribe all of the exercises at once. Now, I do like all 4 of these movements as a full routine, but depending on the patient and how sensitive the foot or ankle is, I will often start with just the first couple of exercises, and then as the pain as the pain settles and they get the hang of the movements, I will often add the ankle squares exercises last. Now, finally, let's talk about progression criteria. Remember, the big picture here, which is what we are doing, is trying to build tolerance and restore the tolerance to these basic foot fundamental movements. Now, what we're looking for here is the point where the motion is no longer limited by symptoms and the patient is able to tolerate and maybe even push and contract into these end range positions. As soon as the patient can tolerate these end range positions, we can then progress the exercises to the next phase. And this would typically be we're moving from a pain tolerance phase to more of a control and mobility phase with our foot and ankle exercise prescription.